Welcome to everybody here that's sitting in the audience, as well as anybody that is on Zoom with us tonight. We were unable to find somebody to do the invocation, so I will do my best here, okay? So if you'll pray with me. Dear Lord, this is a season of thanks, and next week we will have a special day of thanks to be able to show you for all the great things that you have brought to our lives. We are so fortunate, and there are those that are not as fortunate. May we keep them in our minds, may we keep them in our hearts, and may we keep them in our deeds, so that we do good for all of those folks, all of those people that have less than any of us here do. Always let's remember your praises, and keep us making good decisions and working together for the benefit of our community. Amen.
Amen.
Pledge of allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm going to now ask Jennifer to give the attorney overview. This is something new for us.
All right, and I need to find it in the packet. One sec. Is it in the packet, Kate? Is it in the packet? No. Okay. I did not print it.
So I guess we won't do that tonight.
Oh, if you have a copy, I'll read it. I'm sorry, I thought it was in the packet.
She's got to speak into it.
I will
It is
speak
on.
into it. Okay, no, this is my monthly council report. I'm looking for the attorney overview. Okay, well, we're gonna have to start that next month because I don't have a paper copy with me.
Okay, so we are not going to do the attorney and that. It's okay. There's no problems here. It's okay. We'll do it next month. Can I hear a motion for approval of the chairman's meeting minutes dated October 18th, the regular monthly meeting minutes dated October 19th, and a November disbursement of?
$1,226,428.64.
So moved.
Second.
All in favor?
Aye.
Okay, I do want to take a moment and to recognize Karen Deagle here, who was awarded the 2023 Alma Lee Loy Community Service Award this past week. That's a very prestigious award, and it's for distinguishing yourself for excellence in professionalism and also on a personal note for your commitment to the community. So we thank you, and we totally agree with that award. So congratulations.
Thank you for your kind words.
Council report, can we do that?
Yes, we can.
Okay.
Have that. So just to give a little background, the attorney overview is just something that we're gonna start presenting at some of the meetings. It just gives the public some background about who the district is, our purpose, and the things that we do in the community and how we govern and run our meetings as far as public comment and things like that. So I have a script that we will read at the meetings, at the beginning of each meeting as an attorney's overview. We do that for other county boards that I represent, and then we'll make certain that Kate has it to put in the meeting packet going forward because it should be part of the public record as well. So that's what that is, and that's something new that we'll be beginning next month. As far as my district monthly council report, as I've done each month, I've responded to questions from the trustees as they arise pertaining to various matters that we're handling at the present time. Continue to certainly review the annual deadlines and deliverables due to the district under the lease with Indian River Cleveland Clinic and respond to those questions from each of you or staff as they arise as well. We have received a proposed FAR vacant land contract. FAR means Florida Association of Realtors, as well as Florida Bar Association approved contract to enter into for the sale of the hospice house parcel for a fair market value price of $3.8 million by and between the Visiting Nurse Association and the hospital district. So tonight you have before you for review and adoption at a later point on the agenda, adoption of Resolution 2023-05. That gives authority for our board chair to sign the purchase and sales agreement so the parties can begin to work towards an April 8th, 2024 closing date. Another update that I have, of course, is that the district-owned Human Services Building is currently still vacant. The district is continuing to evaluate its options as far as future use, rental, or sale of the Human Services Building. We're still on hold with another matter that's kind of been pending for quite a while now with the county with regard to potential changes to the stormwater retention ordinances and how that may impact the Indian River County floodplain and stormwater code changes, and how that would impact possibly the land that the hospital district owns with regard to the hospital campus. I'm gonna follow back up with the county attorney's office to see if there's any updates on that, or if that can come off our monthly tracking for the report. That's all I have for this month. If there's any questions, I'll be happy to take those.
Just a point of clarification, when you talk about the HSB building, I do believe that this board has passed that we want to work with VCOM. It is just a matter of whether it's going to be a sale or a lease. And I think we're working towards the lease. Is
Yes.
what this
Thank you
group-
for clarifying
Yes.
that, Madam Chair. I think when I wrote this, that hadn't been all the way resolved. And so at this point, we just are looking to define what that agreement's gonna look like as a board.
Right. Okay, financial statement, Michael.
All right, having completed the first month of our 23-24 fiscal year, it's my pleasure to report that the hospital district continues to be in excellent financial condition. As the report included in your meeting material shows, as of October 31st, we had not yet received any of this fiscal year's tax revenue. However, our executive director informed me that earlier this month, we did receive a significant transfer of tax revenue from the county. As I wasn't familiar with the traditional schedule for the receipt of this revenue, I went back and reviewed last year's financials, and I found that in November of 2022, the district received 62.5% of the projected tax revenue, and by the start of 2023, basically November and December, we'd received over 85% of our budgeted tax revenue. So it's likely that we're going to repeat that schedule. God bless the financial smart citizens of Indian River County for paying their taxes early and saving a little money. On the expense side, that report shows 1 month in that both program and administrative expenses are under budget. On the investment front, our investment statement from Deep Blue shows that we hold $2,294,000 in the preferred deposit pool, $2,668,000 in treasury bills, 658, more like 660 in money market funds, and additionally we have $3,100,000 in T-bills through Treasury Direct. So all investment holdings for the district total $8,724,664. Obviously, that number will jump significantly in next month's report after Frank parks much of that tax revenue that we have received in early November into one of those accounts. At last month's meeting, our chairman asked if I knew what the total amount of interest income we had earned at the close of fiscal year 22-23 was. I did not have that number. However, I want to thank Frank, who did the math and reported, it's in that statement, but I'll point out that the total interest from investment less fees was $316,204 in fiscal year 22-23. Lastly, I wanted to report that the Finance and Audit Committee had their second meeting earlier this week, and at that meeting, we did a little deeper dive into our monthly financial statement. We did it largely because I wanted those members of that committee to really get a sense of and a better understanding of where our community's dollars are being spent and invested. We didn't really go into great depth of every program funded, but we definitely took a careful look at all 26 of our funded agencies, and it generated some great discussion. We also began the work at that meeting of creating the accounting and financial practices and procedures manual for the district. Some policies absolutely exist, others are practiced but not codified in writing, and there are other things that we feel that we need to capture. So it's a document that will be important for the district to have going forward. And I hope that within 2 or 3 months, we may have that document ready for your review and approval. And with that, I conclude my report, unless there are questions.
Any questions? No, I think that's very good, thank you. Executive Director report, Frank?
Thank you, Madam Chairman. Before I get into my report, I've got a few updates, and I'll keep them brief. But I just did want to acknowledge Dawn Carboni. So we have Dawn, who's back with the district. She had served with us in the past. Excuse me. Her role is an important one because what she does is she ensures we have transparency and accountability with the agencies that we fund. So I'm glad she's back on board, and she's already working away, doing some great work. So I just want to acknowledge her. So with my updates, I'm going to start with just some follow-up items. Gifford Health Center, we had talked about over the past couple months the foundation repair that was required up there due to some uneven settling. That job has been completed. Unfortunately, recently, we did have an attempted break-in at that property. Attempted, not successful, but attempted. So we're in the process of doing a repair up there to get them squared away. Next item, Independent Special Hospital District Performance Review. We've talked about this the past couple months I've been here and prior to that. So we continue to work towards the completion. The submission is not due till June 30th. However, we wanted to be at the front end of this. This is the first time Tallahassee is requiring special districts to do such a performance review. So we're working with our contractor, BJM, and just making sure that we have everything prepared and we're submitting all the appropriate documents so we submit the best possible performance review.
Frank?
Accurate
Would it be possible for you to send to all of the trustees what kinds of things we are sending to them so that we're aware what they're asking for so that we're staying kind of aware of what's happening there? I would appreciate that. Thank
Will do, absolutely. And we just had a call with them this week. The plan is that we have a draft document at some point in January, which they committed to that date. And again, submission is until June, so I think, we're definitely ahead of the plan for that, but that's on target. Third, I just wanted to mention, and there was a story in 32963 recently, the Edward Via College of Osteopathic Medicine, VCOM, as we call them, and our Human Services building. So our conversations continue on that project, the ultimate goal to bring a 4-year medical school to Vero Beach, which would be fantastic, focused on primary care. So we continue with those discussions. Jennifer Peschke, our counsel, recently submitted a lease to them because what we had decided was we wanted to look at a lease to purchase option. Our properties are very valuable that are owned by the district and of course by the taxpayers. And we want to be sure that the projects that we commit to, if we're going to sell a property, folks are going to be in this for the long term. And they're going to be here, we're not talking for 5 or 10 years, we're talking decades. And that's what we hope to get out of the project with VCOM, is that we could provide a stream of primary care providers who will stay in our community for decades to come, which is huge, and I'm very excited about that. UF Health Center for Psychiatry and Addiction Medicine, just brief update. That's been a wonderful collaboration. Since I've been here in Vero and with the district, I continue to be amazed by the collaboration that we have with everyone who deals with mental and behavioral health in the community. Huge need, as we all know. And with UF leaving, trying to make sure that we have a plan for coverage for 2,600 patients is not a small task, especially with a specialty like psychiatry. But in my update, I just want to say that we have till December 29th, where UF is actually seeing their last patient on that Friday, and the end of January, where all the prescriptions will expire for those who require medication management, where when you're in the psychiatry business, that's quite a few of our folks. So we're making some solid progress on that plan. There may be an opportunity for the district to get involved to just make sure that certain folks who have certain insurances that we do not have providers who are par with those insurances in our county. So we have a plan to make sure that there's a significant transition period until we have further psychiatrists and psychiatric nurse practitioners who could absorb those patients. We do know that all our providers who do provide behavioral health services and psychiatry services in this area, everyone is trying to hire. So we're hoping to at least make sure that there's a window with which we can ensure people have their prescriptions filled until we get some new providers on board. And we've got all our local partners helping out with that effort. So that's been fantastic. Two new items, and these are kind of new. One is completely new, but one is I've talked about maybe a little bit. So one of the things that I recognize is that in this county there's a ton of amazing work going on to make a difference for the health and well-being of others. But there's been a lot of stuff done by the district over many years. And because we have such a fantastic and humble staff that are sitting in front of you, plus Anne Marie Soriano, who I'm doing my best to try to fill her shoes. But I will say that I don't know that we do a good job of telling those stories. And I don't know that we do a good job of showing the data to really illustrate the impact of what we've done. Well, that's going to change because one of the things that we're going to do is focus on that. We're going to continue to not just do the work we're doing, but even do more work in collaboration and filling the gaps and ensuring access and planning for the future. But what we're going to do is we're going to work and we're going to start to present real solid data so we can measure the impact. Also with stories about, I hear, there hasn't been, and I'm not ashamed to say this, but there's been several times that on a lot of our site visits, it's brought me to tears with some of the work that's being done. How grateful that I am to have what I have, and there's so many who have so little. And those are the people we're working to make the difference for. So this is all about impact. Everyone knows that word in the nonprofit world, and that's what we're trying to do. So what we're doing is we're gonna do a campaign along the lines of updating our website, updating our logo, just updating our brand and our image. And it's not because we're trying to market the hospital district, just because we really want to clearly illustrate all the work that's been done going all the way back to 1959. And the last item I have, I did say I'd be brief, is we just had so we have a property management company called Lambert. And what they do is they're managing our vacant property on the Cleveland Clinic campus for the Human Services building. And anytime a property sits vacant, there's issues. You've got leaky air conditioners, you've got leak from rain, you've got lights that are out, you have all these sorts of things. I think it's in the best interest of everyone that we maintain and we keep up this building. They've been, I don't know that we knew that it would be vacant for this amount of time. And we don't know how long it's going to be vacant for. So we just updated an agreement. We didn't have an agreement before that we were paying a very nominal fee just to keep an eye on the building. But as there's work that needs to be done there, I just recently updated our agreement. They were looking to make sure that, they were, fairly, compensated for some of the additional work that they've been doing. And of course, this has a 30-day out, like almost any contract I would sign by either party for any reason. So that's my report. Thank you.
Any comments or questions from anybody?
Just as to the VCOM lease with the lease to purchase, it's been a while since I looked at the minutes. I remember the moving to the lease option, but the purchase, my only concern is there's only so much real estate immediately adjacent to the hospital facility. So it's a premium. And engaging some expertise to help us evaluate the potential efficiencies that may exist around that property if it remains available long-term as our population grows, and whether a lease to purchase, or I'm not opposed to leasing long-term, but 40 years from now when our population is whatever it is, are we going to regret that that is a school that could be someplace else? because of its potential usage. I was given two names. I don't recall who they were. I think, Frank, I may have emailed them to you. People that have expertise in that area. I can't tell you exactly what that expertise title would be, but these are people that have the ability to take a look at a medical facility like ours and discern that. Now, the decision may have been made. I may be misrepresenting. In other words, you guys may have already voted that it's a lease to purchase and we're out the door and,
No, I would say that what we decided is, A, we wanted to support VCOM.
right,
B, we wanted it to be a lease and not an outright sale, which is what they came to us with. They wanted to buy the property, and we were not comfortable with that until we knew that there was a commitment. I would say at this point, we have not said that it was a lease to purchase lease,
okay.
okay? So I think that's where we are. Jennifer sent them some examples of some
Right.
leases.
Okay.
We have a lot of discussion to have.
Absolutely, but I hate to have us go down that path with documents that Jennifer's preparing and going back, in that process without having
She's
us-
not preparing the
No, I
document,
wanted
they
to
are.
clarify
Okay.
what Frank said. I sent them a template lease that we've
Right.
used in the past for that property, nothing specific. I
Okay.
would never send that
Because
without
quite
the board's
honestly, when
authority.
we said we wanted a lease, their eyes got very big and they went, whoa, we're not sure how to do that. And so that was the
Good.
the thing. So we're just in the beginnings of discussion. Okay?
Thank you.
Okay. Okay, a funded agency report, Sunshine Physical Therapy. You guys know you need to come stand up here. Sorry, at the podium. And if, please introduce yourselves and then,
Okay. Hello, Madam Chairman, Board. I'm Ginny Blossom. I am the Executive Director of Sunshine Physical Therapy Clinic, and we're very glad to be here today. I have with me my colleagues. Heather, you can introduce yourself.
Heather Moxley, I'm the Assistant ED and Clinical Director.
Katrina McMahon, COO.
So first, I would just like to thank you all for the support you've given Sunshine, and certainly we're here to answer any questions you may have about the written report that we provided. Sunshine has been doing an excellent job over the past 8 months in recovering from what was a very tragic year last year, and we're looking forward to a good end-of-year outcome. I have been focusing primarily on how to build financial sustainability for the organization while also allowing it to continue to grow. One of the problems, if you've been there, and Frank was wonderful to come and visit and see what we're all about, we are landlocked. We only have so much space. So one of our efforts is going to be starting to work with off-site programs with other organizations around town who could utilize our therapy services, but who don't have their own in-house therapy. That is one thing I discovered as I was starting to work through all of this. And I've said this to you all before, I'll say it again, Sunshine is a failing business model. There is no way that we could survive with the level of therapy that we have on insurance reimbursements alone. So we're very grateful to the hospital district. You are a very important component to our ability to continue to provide care to those on Medicaid or uninsured. And there is a gigantic population out there. I think that one of the improvements that we have made, and again, thanks to you and to the CSAC board, is improving our measures and our outcomes. That has been something that I think we were lacking early on, and it's something that our entire team now is very focused on. So I thank you for that. I know Heather has worked very hard to revise those, and we're confident about their ability to provide you with the data that you're looking for when it comes to our success rates. We do run on a financial support program. And one of the items that I discovered as I was working through our business model was that we were providing quite a bit of financial support without the funding behind it. And so I think part of what you saw in last year's financials was partly due to that. We're going to make adjustments to that. And again, we thank you all for your support for our pediatric patients. We do see a lot of Medicare patients who have Medicaid secondary, and they often also are in positions where they need support, and we will provide that to them. We have circumstances where individuals have very high Medicare copays and they can't afford to pay them. So one of the things we'll be starting at the beginning of next year is a sliding fee scale so that we can recoup some, but we can be very cognizant of people's ability to pay. Our scheduling process has been adjusted quite a bit this year, and that has improved our cancellation rate, which has been dropping significantly. We put a new position in place. Our scheduler has been working closely with our therapists so that we make sure we have refill rates when our cancellations are coming in. We were at 26% cancellation at the beginning of this year. We're at 17 now. And a lot of that, too, is due to a more rigorous cancellation policy that's being enforced and being enforced very well with our scheduler, who has changed quite a few processes with our patients, and to great success to our bottom line. You asked to address emerging issues that we've been seeing, and I'm pleased about primary care coming into town, because one of the challenges that we do have is signed plans of care. We only have 30 days for signed plans of care to be signed by the primary care doctors, and it's extremely difficult to get in touch with some of them. We spend quite a bit of time trying to follow up, getting the signed plans of care in place so that we can schedule these clients, and there are times when they need to be seen, and seen quickly. At one meeting, Dr. Cooney, you had asked what you might be able to help us with Cleveland Clinic, and I think building stronger relationships so there's a bit more urgency to getting those plans of care signed and back to us so we can see our clients would be tremendous. I was over at my own concierge medicine primary care before I came here, and she acknowledged that honestly concierge medicine could also be putting some pressure on the primary care availability to a majority of our clients. TCCH, Whole Family Health, they are, I can't say how important they are to this community. Because I'm sure they've been seeing an influx of people in need, and their primary care programs are critical. I'd like to think we are as well. We are the only nonprofit that will take and continue to see people on Medicaid and the uninsured. The for-profit clinics aren't likely to be doing that because it is, like I said, not the best business model. But there is tremendous need, and without Sunshine, that need would not be met. So I will do everything I can to maintain its viability in this community, and I thank you again for your support. We do see behavior issues, and again, I know that some of my colleagues are working on that, but behavior therapy is something that's sorely missing in this community. We have children who will come in exhibiting behaviors during their therapy sessions. Their therapy is useless at that point if they are having outbursts. We don't have a behavior therapist on staff. We, quite frankly, couldn't afford to have one on staff. But we're seeking relationships where we can build a behavior therapy what am I looking for? What's the word? Well, a resource that we can cross-refer. So I look forward to adding that to our mix next year. The therapy pool here, for those who have been seeking therapists, is very small, and they command extraordinarily high salaries. So I'm very proud to say that our therapists, and we have grown a bit since we last spoke, are of the highest quality, and they choose Sunshine because of the environment that we work within. It's It's very much a stable therapy staff, and I want to make sure that they are as available as possible to everybody in the community. So our relationship with ARC is one good example of how we're going to be exploring our off-site patient therapy programs. There are plenty of others out there that I would like to build relationships with, and certainly am open to anyone's ideas. And I think what you're going to see in the next 5 years, hopefully in the next year, is expansion of Sunshine services and a higher recognition of what it is we do and who we are. I sat with 2 different funders the same day, each one talking about our commercial venture. And I asked where that came from, but I can understand that we do take all major insurances, but we also support Medicaid and the uninsured. So there is a misconception out there that we're a for-profit company with a nonprofit interest in Medicaid. I like to refer back to Vicki and TCCH because we are very much on that model, but I don't think that people have understood that, and that's something that we're hoping to change. Similarly, we provide therapies for children as well as adults, and that's something that we need to get out there as well. So we're proud of our quality, and we're proud of our patients, and we're proud of our progress, and we're grateful for you. If there are any questions.
I want to ask about good work in reducing the, the no-show to 17%. That's one of those things for years. I mean, let's go back 15 years and the start of the Mental Health Collaborative. I can hear the voices talking about this. Always a big issue. 17 still sounds high, but in terms of this, what's, you know, is that kind of average across the board?
Well, I would say it's impacted mostly from children. Because of the clientele, 85% of our kids are on Medicaid, and transportation is a problem.
That was going to be my
We've
next
talked
question.
about that
I wondered,
before.
yeah.
I don't want to get into the transportation issue. Just that industry, I mean, Karen, you know, it's a big project. But we do have those Medicaid patients who have a hard time getting to school, to therapy programs. Children are sick. Parents are working with one car. There are a number of reasons why the pediatric program really does impact our cancellation rate. I would like to get to a point where we are at a 90% visitation rate, so down to a 10% cancel no-show. But that also includes the refill rate, where somebody's canceling, but we're working hard to fill that spot.
Right.
And I think that is probably the more realistic direction for us to take right now. We can tell parents only so many times, 3 strikes and you're out, but if they can't get there, they can't get there. So.
Okay, thank you.
Jenny, when you introduced yourself, you said executive director. There
did.
wasn't an interim in front of that. And so has that changed, or you just?
I didn't drop it by
Purposefully?
accident. The board did approach me and asked if I would stay on, and I am now on staff as the executive director.
Congratulations.
Well, thank you.
Good for you.
May I just add? Yes. So I just, as a physical therapist, and observing your operation, just very impressed. If they can get the no-show cancellation rate to 10%, seeing pediatrics with their Medicaid payer mix percentage, that would be amazing, because those 2 things make a tremendous difference in your cancellation no-show rate. They just do. It's your population, your payer mix. So, I come in and very impressed by their facilities, very impressed by their therapists. They run a fantastic operation, and I'm very glad you're here in the community, so thank you.
Thank you.
Jenny, I'm going to reach out to you, just made a note in my notes, to reach out to you and chat with you about the transportation situation.
That would be
I am assuming
tremendous.
it's the Medicaid portion of it that is challenging, and we're trying to look at this at the state level. And I'm working on a couple different things, so I'd like to get your feedback. So.
Absolutely. I'd be happy to. Thank you.
I just want to say, I think you've come a long way from where you were before, and I know it's been a hard uphill climb for you to do that, so. But again, your services are so needed in this community, and there is nobody else doing what you do. So, we need you, and whatever support we can give you, we're here,
I
okay?
appreciate it. I appreciate your increased support for the year to come, and we're going to make you proud.
I'm glad you're at the helm of it.
Oh,
That's gonna make
thanks. I appreciate
too.
that.
Yeah. Thank you. Appreciate it. Dynamic Life and Healthy Start were written, so I guess if anybody has any questions in that, to take them on to Jenny, and she can forward those on to them, right? Unfinished business, we have the Globe Check funding request. Frank, you want to go through that, please?
Yes, so after following our discussion yesterday at the chairman's meeting, we have calculated a funding request. So the initial funding request was $336,000. So we've updated that funding request. Jenny has updated that funding request. We did some calculations, and what we're looking at now is $282,000. So that's the amount that we're looking to be.
And just for clarification, that's paid out as they do the scans, right?
Correct, invoiced.
So because this was based on X number of scans times whatever, so it is not it's an issue of, if they hit that number, then it's good. If they don't, there's money left, et cetera, right?
Correct, but I would add one caveat to that. So that would be for today. If they are able to secure a driver and take the One Globe, the mobile globe, to more folks, more exposure, more access in the community, but also if they are able to work with the school, and they are able to get into our schools and do those screenings as well, that would be a different discussion. That would be an additional discussion and an additional ask at some point down the road. But my recommendation would be, once those operations are up and running and they're in place.
So they could come back is what we're,
Correct,
yeah.
correct.
What is,
I would say there needs to be a solid plan.
Absolutely, and that's
Solid.
part of it, exactly. There has to be a solid plan, strategic plan on how they're going to execute this, how they're going to operationalize it. Exactly.
I guess when I did the math, 54,000 differential between their ask and the recommendation. Where did was that number of scans? or what?
Recalculation of the scans.
Okay, based
A
on prior.
realistic number based on exactly.
Okay,
Request was on 4,800 scans, and they only did a little over 2,000 scans last year. So we'd like to bolster it a little bit, but like Frank said, see that they have a solid plan in place, and then we can go from there.
right. And if we have in our budgeting request originally, this was not in there, correct? Okay.
So this would come out of reserves.
Right, we need to, was just double checking, we hadn't set anything aside, and we did not.
No, that would come out of reserve.
Yes.
Frank, I was trying to track the numbers in the email that you forwarded us this morning, I think. So 984 scans, 29,520, and that's at United Against Poverty. And then 3,000 scans for $90,000. Where do we get to the 282? What number am I missing?
Well, so it's the initial 192
Okay,
plus 90,000. So we take the average scan price times, I think what did you say, 3,000, right?
Yeah.
Yeah.
3,000 scans at $30.
Right, correct. There's your 90,000. So we recalculated the estimate, because initially, the scan, this was based on 4,800 scans, which is them getting the globe to multiple sites, which we want to be sure that before we approve the funds, that there is a plan in place and they can get to that number. Do I think they can get to the number of 4,800 or even more than that? Yes. But that's not what we see. What we see is realistically, they can do 2,500, 2,700, and if they can get to 3,000, that's great, but we're being conservative on the number. And if they have a plan in place to do more, we would, we'd bring it back.
So when we say we want to have a plan in place, if there's no plan in place, are we not going to approve anything tonight? Is that kind of what I'm hearing?
This is to cover what's at United Against Poverty and at
Correct.
Whole Family.
Family.
And Whole Family.
Okay, thank you.
This is already existing.
So the number would increase?
Correct.
This will just
Beyond
cover
that.
those two. Okay, the number would increase if they had a plan in place.
So the base we're looking for is
For
the
other-
282.
And it's their mobile unit that they need to have the
They're
plan
having-
wrapped around.
Right. Which I have said, I will have a discussion if there is any interest.
We think there's a lot of opportunity for that, and I think we all agree on that. But initially, the 282,000 funds, what we know is currently working and what we know is showing results and what's identifying disease in people who would not normally be scanned. So we know that this device is making an impact. But we don't want to guarantee more funding until we see a plan on how we could extend that impact.
So do I hear a motion?
So moved.
All in favor? Aye. Okay, hearing none?
Thank you.
That's approved, thank you. New business, Jennifer?
Okay, so I have before you Resolution 2023-05. I will note the one in the packet does say 2023-03, but we have edited that. And the one that our board chair will sign will be 2023-05, 04, and 03 and 04 were used in our budget and millage cycle. So we are on number 5 for 2023 as far as resolutions go. So what this is a resolution to authorize our board chair to execute a vacant land contract for sale and purchase by and between the VNA and the hospital district with a fair market value purchase price of $3.8 million. Prior to this, of course, the VNA let us know on May 9th that they'd like to exercise their option to purchase the hospice house parcel, which was derived from the lease they had with the district and the party on behalf of the VNA. We accepted that option to purchase and entered into Resolution 2023-02, declaring the property surplus. So now we're at the point of entering into a purchase and sales agreement and just requesting a motion to approve our board chair entering into the Resolution 2023-05, authorizing her to now sign that purchase and sales agreement. So do I have a motion to approve Resolution 2023-05?
So moved.
And a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? Motion carries unanimously, and we'll go ahead and enter into this as well as sign the contract after the meeting.
Do you want a black pen?
Yes, I want a black pen, not a purple pen. I'll sign it. Okay, any other business for trustees? Okay, hearing none, any public comment? No public comment? We had a thank you from who?
Anne Marie.
Anne Marie and
Oh, Anne Marie McChrystal, yes.
Carol.
Okay, this is a new one for me. My name is Sharon Wolf. I'm a resident of Vero Beach for 19 years, and I would like to thank the hospital district. I haven't done it before, but I'd like to thank you so much for bringing Cleveland Clinic to us. I feel that I wouldn't be here today if it wasn't that Cleveland Clinic had the tools and the capability and the skill to take care of myself, my family, and I really do appreciate that. My personal feeling is we wouldn't have made it through COVID. I don't think we would have made it through COVID if we had not had the quality of care that we did. I happen to be also on a committee. I'm a co-chair of the Healthcare Partners at Cleveland Clinic. So I guess you could say I have a little bit more personal interest. I really believe in this. They asked us, I started off with the Patient Advisory Committee back when it was Indian River Hospital. And then they turned it into Healthcare Partners. And what that is that as a citizen, we come in, I happen to be the co-chair, as I said, we're able to bring any questions that we have, any concerns, and actually even suggestions for programs, suggestions that they just might not have thought of for Vero Beach. And so far, the transparency and what they have done for us by listening, by taking it to wherever they have to take it, I guess to the enterprise, to the higher level, but they do it. They're very supportive of us. They come to our meetings once a month, and it's executive branch as well as people from the community. You probably have never even heard of us, didn't know we're there, but Cleveland Clinic does know we're there. The simplest of things, but the things that change the care and the feeling that people, because that's the hardest part, as we know, is changing the feeling of the public. When they asked me to be co-chair, they said, well, what's your goal? What do you want to do? And I said, well, this kind of seems lofty, but we've got to change the opinion of the public of Cleveland Clinic. Give it a chance, let it develop, let the programs develop, and in the end, we are going to be far better off than most of the communities in the state of Florida. So I don't know if you've got questions or anything. I didn't prepare a speech. I just decided to come to a meeting because I also came from Leadership 2.0. And what that is hospital staff, community members, and they let us go out and do roundings. Today, I happened to go to the department and ask questions. What guy worked there 38 years, the other one's pregnant, she's leaving, so forth and so on. But we got to see the hospital from the grassroots. They don't care. It's all right with Cleveland Clinic administration. We go in each month, we go to a different department, and we get to see what's going on. And that helps me to take it back to the community I live in and the rest of Vero Beach and say to them, you're not going to believe the new machine they brought in. It's an interventional radiology something or other. It just came in. This is a fantastic thing, and it just keeps happening. And we don't all know about it. I don't usually know about it except for my meetings. Maybe you do, but I didn't. So I just wanted to say, step up here tonight. I came right from that meeting and thought, they need to know this, that as a community, we're better off because we have Cleveland Clinic behind us. It's a big operation, and they know how to do it. They really know how to do it. So that's all. If you have any questions.
How many people are on your group?
As far as the community members,
Yeah.
I think we're at 8 or 9 right now.
Okay.
But the people that come in also, Dr. Peter comes in. He reports the good and the bad and the ugly. And
But there's 8 community members on it, is that correct?
8. 8 community members are on
Okay.
it.
And how were they chosen? How did they become part of it?
People who had had experiences as patients, volunteers who realized that we need to have a voice with Cleveland Clinic. I think that's it. Most of them have big concerns, have been patients, and bring it forward. Yeah.
Yes, that's an excellent report. How do people reach out to you to communicate better what you're trying to do?
Yeah. Let me tell you something. All you have to do is walk outside your house door and someone says, aren't you on a committee at the hospital? And you say yes, and they say, well, I this or I that. Or I had a friend who was in the hospital a few weeks ago. She fell, broke her hip. She's, 89 years old or something. Anyway, she wrote up a whole thing, again, about the good and the bad, because of course there's going to be. I was just in emergency for myself. Thought I was having a heart attack. I'm not. Anyway, and that was a week ago Sunday. I was very scared, 2:30 in the morning. But I went into a hospital that took me in, did all of the testing that they could possibly do, and they figured out, you're not having a heart attack, you're okay. Now, did it take me 8 hours? It did. I was in the emergency room for 8 hours. I don't care. They found out I didn't have a heart attack. So that's the personal side of it. And I can tell you that as a healthcare partner, I had my phone out and I was taking notes They didn't know I was a healthcare partner.
Ask you that.
Oh, yeah, no, I don't let them know that. But I made my comments mostly good, but look, there's gonna be some things that need to be worked on, and I wrote them down, and at our next meeting, I will be presenting them to Dr. Peter and to the other people that are part of our committee, nursing staff, and they'll know about it. That's it. Anything else?
How do we get the community to know about your group? I think that's really important.
Yeah, I think that's the hardest part is, even in the hospital, they don't really know us. You know, like the average nurse, or the, not average, but the nurses, or today, as I said, I went to the facilities department, and, you know, these guys are the cleaner-uppers. They didn't know who I was. But, so that is a difficult thing. I'm not sure. I just think that's why I came. I think that's why I came today, because you didn't know about us. Now you do.
I have a question.
Yes.
Dr. Peters was here last month. He brought out that there is a phone number that individuals can call if they have concerns they want to share.
Ombudsman.
The Ombudsman.
It's called the Ombudsman.
Right. Now, do you deal with any of those complaints at all? Are they presented to you so that you can have a conversation about it and maybe help them come up with solutions?
No, that is a department from Cleveland Clinic, and they do that.
Okay.
Now, yes, not individual complaints or anything, no, we don't.
Okay.
Only the ones that I get when I walk out the door of my house.
So what kind of issues do you deal with then? What kind of things would you bring up at this meeting?
It's such simple things, and I'm almost embarrassed sometimes to say how simple they are. But months ago, it was my thought that we needed to say thank you to every single level of person at the hospital. How could we do that? Well, we came up with a pretty simple plan, but not all that simple to execute. We had keychains made that said thank you for what you've done, what you do, your heart, and so on. Sounds small? Well, I took it to Vero Radiology. We gave them to 2,500 people, every employee. The volunteer auxiliary of the hospital paid for it. That's their commitment to making it better. So we had to organize that, give it out. We did that on Monday, 2,500 people. When I walked into Vero Radiology with 2 bags, one for each employee, first of all, the woman looked like she thought I had a bomb in my bags because I walked in like this. She was very nervous, and I said, I know this looks strange, but we really are just coming to say thank you. Her demeanor changed. I know that's very small, but I have a feeling that if you talk to some of the nurses or some of the others, it might have made a difference that day, even if it's a smile for just that day. I think we start small. Things like we looked at it and said, this lobby is terrible. How about, what can we do? What first impression? What can we do to change that first impression? Little things like that. The red coats, we ended up getting plants for the lobby. They're going to have a service, change them over. So it's very small things, but then it's also care things. What can we do about we all know physician shortage. That's why I'm so glad to hear that we're gonna get this osteopathic school. And hopefully we will be able to do some things like that, get some better referral processes. It's pretty grassroots. It's really very grassroots.
Thank you.
Yeah, so that's it. Thank you for listening, and thanks for all of you for listening, because I'm not a professional speaker, but my heart's there, so thank you so much.
Thank you. Thank you very much for coming. Anybody else want a public comment after that? All right, thank you. With that, we're going to adjourn, have a happy Thanksgiving, and remember to say thank you for all the great things that we have with each other and our family, and share every moment of it. Happy Thanksgiving, everybody.